All right, we are told that sometime this week it is possible that Republicans will have a plan ready to replace Obamacare, the plan that we have right now. They're all in agreement by and large in rejecting the law that's on the books right now. The devil is in the details of finding somebody to replace, and they do want to do that. But here's the trouble and the problem for Republicans. They're not all in agreement on this replacement plan being concocted largely by the leadership. With a lot of House backers, but not enough where it doesn't risk being torpedoed in the Senate. Former BB&T Chairman and CEO John Allison on what he makes of this battle. I think it's fair to say for the soul of the Republican Party, don't you?
I do, Neil. You know, it's interesting. The Republicans are supposed to be the party of limited government. As a libertarian, I think I can be objective about how they're doing in that regard, and it's not so good. You know, they got elected based on the idea of really repealing Obamacare. In fact, when I met with President Trump, he said that was a key factor in him getting elected.
But I do wonder whether they took the cart before the horse, though, right? I mean, they all were in agreement they didn't like the law, and many would readily agree with the shocking, premium hikes and the high deductibles. It's not panned out the way it was. And of its own accord, it will collapse unless both parties does something in soon. Yes. Having said that, though, there was much more broad agreement on the part of Republicans for tax cuts than this. It's probably a moot point at this point, but do you think putting health care first with all the divisions it relayed and revealed among Republicans, it was a good idea? No, I don't. And I think a lot of that was arguments around some technicalities about a bill that was passed last year. But, you know, the irony, Neil, is I actually think it's relatively simple to fix if they would act on principle. They should repeal Obamacare, including the regulations, which is the worst part. Secondly, they just block grant Medicaid to the states, which would create the states could focus the money on poor people and also could create competition and innovation among the states. And thirdly, they do large health care savings accounts and shift the tax deduction from corporations to individuals. You see, it'd be a huge benefit so that individuals could negotiate their own health care. I need different health care than a 25-year-old. That would create price competition, which is a real problem in medicine. There's no price competition. And also it would create an incentive for me to take care of my health, because the doctor says, listen, if you don't change your diet, and you're going to have some serious expensive problems in the future. It's actually pretty easy because you let markets work. No, you raise good points, except on taking care of yourself and eating right. I mean, I find this whole food pyramid thing annoying. But what I discovered, John, with all of this, and all kidding aside, is that the real chore here is getting young people who always feel, when it comes to their health, bulletproof, to sign up and to do this, because they kind of pay for it, regardless of how they're recruited, through credits or whatever. And they just can't seem to do it, Republicans or Democrats, or find a means by which young people can enter the system. How do Republicans answer that?
I think a health savings account does that, because it's your money, and you make the money available. Say, look, you know, you can use it for health care, or you can use it to go to a university or something. So it's your money, and you buy the insurance you want. But I think the fact that now you don't have any control over the money, and if you disciplined and didn't spend money on health care, you're actually paying for somebody else.
Yeah, no, you're right. And the irony is that even those who are covered and have insurance, and it's always a good thing, no one denies that or argues with that, is that deductibles are so high and premiums so high that many of them are delaying needed follow-up care because it's so costly, and getting sicker as a result.
Well, the way the program works now, you are actually, if you're healthy, you're paying for a lot of other people.
Right,
and I think that's a huge disincentive. And what we really, I think the biggest issue is competition. You know, if you grocery store food prices as a percentage of income have been in a free fall for a long, long time, and it's not because the grocery stores are nicer people than the doctors. It's because there's competition, and the system we have now destroys competition. Plus, I was a large employer. We had 30,000 employees. How can you design a plan to meet the needs of 30,000 people? It's ridiculous.
Yeah.
Somebody 60 years old and somebody 25 years old with no children. I mean, those are very different needs.
And this is the reality.
That's why you need individual
And you can do it for free in the sense because the corporations are already getting the tax deduction. You just shift the tax deduction from businesses to individuals, and corporations would actually like it because when I was running BB&T, I knew I didn't know the right answer for all of our employees. I could try hard, but there wasn't a right answer.
Yeah, give them the flexibility. John Allison, former BB&T chairman and CEO, thank you.